One of the most common questions we get when we start talking about lunging, squatting, deadlifting, a lot of these lower body motions with our patients is, can my knees go in front of my toes? I've heard this is not a good idea. It's going to cause me a lot of problems. And there's a little bit of a complex answer to that, not too bad. The biggest things that we look into is ankle range of motion and foot position. If you have a good tripod of the foot, meaning we have a good even distribution of weight between the heel, the base of the big toe, and the base of the little toe. We have a nice even like little tripod distribution on there. As long as we can maintain that, as we descend into a squat, a lunge, any of these lower body patterns, you can bring your knee in front of the toe. As long as the heel doesn't lift up and we maintain that weight bearing, you should stay pretty centered through the foot. So you have a nice even drive through the center of the foot. So we're not getting either like a forward drift onto the toes, which we tend to have to push back with our anterior chain with our quads, which is going to throw off some of those natural motions. So whenever we're assessing our squat and whatnot, when we get into some of our lunging forward ankle dorsiflexion assessments and things like that, for high level athletic movement, some techniques actually recommend up to 2 to 4 inches of the knee actually in front of the toes before we see any deviation of the arch collapsing inward or outward or the heel lifting if you're going to be going for some higher demand activities. And one of the issues that we run into with kind of blanket rules like this is whenever I go into a squat, there's a natural advancement of the knees forward over the toes to maintain a good upright spinal posture as I go up and down. If I try and keep my knees further back, in order to stay upright, I have to sometimes get an excessive forward lean that isn't necessary. I start rounding my shoulders. So you just pass the problem up the chain. So instead of fixing the issue down through the lower leg and just kind of getting around it, we can actually create a whole nother slew of issues coming upwards, which we then have to sort out. So in summary, whenever it comes to knees coming over the toes, the question for us is more starting at the foot and ankle. Do you have the movement competency there to allow that? And if it's not, we have a whole set of breakouts to analyze that and get into it in order to improve it for you.